I've lost all of my event business for 2020 as all of those big events happened during the spring and also the fall. And of course, with COVID, all of the events have been canceled because people don't want to gather and haven't been allowed to gather. I have been able to do some singing telegrams because you can stand 6 feet apart and remain, without touching anybody. So I'm glad I've gotten to do something, but my business is down 75%. So I had spoken to some brokers who encouraged me to sign up for healthcare.gov, but they didn't realize, and I didn't realize, that I didn't really qualify for it based on my tax returns. And one of the brokers eventually told me that I would have to either take deductions on my tax return or have health care, but I couldn't do both because I would never qualify according to the system. I don't qualify for Medicaid because I'm not disabled, I'm not pregnant, I don't have children, and that's basically all that Medicaid covers here in Georgia, and it leaves us kind of people out in the cold.
That's why I rise again on the Senate floor to tell the story of another Georgia. A story that gets to the heart of why this bill is important. This is Amy Bielawski. Amy is an owner of a small business, Hairbrained Productions. It is an event planning and entertainment company in Tucker, Georgia. As you can imagine, Amy's company took a significant hit during the pandemic. Unable to book regular gigs and plan events that all of us miss as we have been clawing our way back from this pandemic. Amy qualified for unemployment benefits this past year. And with that critical support, Amy had temporary access to affordable marketplace plans created by the Affordable Care Act. But with the end of Georgia's unemployment benefits looming and the entertainment sector still suffering from the effects of the pandemic, her access to coverage, the coverage she so desperately needs, is on the brink. Again. At the same time, she will have to manage her thyroid disease, high blood pressure, pituitary gland tumor, fibroids, and all the other health hiccups that come along with aging. If Georgia was to expand Medicaid, or if there was a federal Medicaid program for non-expansion states like Georgia, Amy would no longer have to worry about getting reliable health coverage for her chronic conditions. This is the human face of the public policy we make, or the public policy we fail to make.
I would like to say to the policymakers that there's a huge sector of Georgia that's being left out because of their not expanding Medicaid, and it would be amazing if those people could be taken care of.
Medicaid expansion has always been the moral and cost-effective choice for Georgia. The new incentive package just amplifies that choice. Don't tell me you're going to keep this going and send me this lovely letter and then stab me in the back. I try to be as healthy as I possibly can so I'm not needing to run to the doctor, but there's no backup plan when something goes wrong. As an owner of a small party and entertainment company, I live to perform, draw laughs and make others feel good. On any given day you might find me delivering a comedic greeting dressed as Marilyn Monroe or Lucille Ball for birthdays or anniversaries, or pranking people's coworkers in a giant gorilla costume or a furry chicken suit with a tutu. You would never guess I do it while living with multiple health issues and no health insurance. While I put on a brave face and focus on bringing joy to others, inside I'm worried because I know I likely can't afford to cover the cost of treatment or even regular checkups or doctor's appointments.
Hi, my name is Amy, and I'm a business owner in Georgia for 26 years, and for most of the 26 years I have not had health coverage.
As our state's healthcare options stand now, Amy says she, quote, doesn't think they care about people like me falling through the cracks. Even more disappointing, when asked what Medicaid expansion would mean for her, Amy was reluctant to even picture that future. She said, well, it's really difficult to say because I've never had consistent health care. It is hard to imagine. Think about that. It is hard for somebody who works every day. The kind of entrepreneurial thrust, serious work ethic, grit, and determination in the richest country on the planet, she says, it's hard for her to imagine having consistent health care.
Medicaid expansion can't wait.